Back to another episode of the House Husband Diaries. As always, I am your host, Carter C. And today we are back on the politics and economics phase of, rotation. And really, what I wanted to share today, it's going to be a little bit different. I've got an article up on my screen, and so I can't really see what I'm doing, but I'm going to read the most parts of this article from the New York Times because my wife sent this to me. She saw it and she said, "Hey, here's like your opinion, but it's basically better worded than what you have to say." And I was like, "Thanks, I appreciate that. I think." So I have a tendency to kind of say thoughts and maybe not tie them up as neatly as maybe some other people that may take more time. But with this whole coronavirus thing, I'm not a big fan of just shutting down states. I think we have really huge economic consequences that we will feel months and years from now. And so I was trying to say this, and there were some people that said, "Hey, that was really offensive when you were talking about not quarantining and all this stuff." And I totally get that. Like, that doesn't bother me that you disagree with me. What bothers me is that I don't think that maybe I explained myself fully. And so this video is really this opinion article in the New York Times is by a guy named Thomas L. Friedman. And he's, you can look him up. I didn't really look him up other than what he put in his byline. And he's written a number of books and he's won awards. And if he writes for the New York Times, I figure he probably is a little more left-leaning than I am. And since this was an opinion piece in the New York Times, I figured it was, for those of you who are more left-leaning than I am, then you would at least say, well, at least it's in the New York Times, right? So basically, this article was written on March 22nd, 2020, and it's called "A Plan to Get America Back to Work." Some experts say it can be done in weeks, not months, and the economy and public health are at stake. So I want to kind of just read some of this and then I'll talk about it. I'll stop every now and then, but that's, this is just going to be a different kind of video. But I really think that this is a professional author who, like I said, has won a number of awards, and he really kind of gets to the points that I was saying earlier last week that maybe some people found offensive. You may still find this offensive, and that's fine if you do. Everybody has a right to their own opinion. But I think other doctors and other professionals are saying very similar things to what I was saying. Maybe they said it in a slightly different way. Maybe it comes across a little more polished than how I was saying it, a week ago. But this is basically what I was trying to get across. And if I didn't convey it appropriately last week, I hope this is, maybe will convey it in the right way. If you still disagree at the end of this, that's fine. Agree to disagree and move on. As always, I really appreciate every single one of you that subscribes to my channel. It means a lot to me. And if you like the content, if you like what we're trying to do here at the House Husband Diaries, click the subscribe button. It takes 2 seconds. It doesn't mean a lot to you. It means a tremendous amount to me. And I just really appreciate it. So for all of you that have taken the 2 seconds to subscribe, I really appreciate it. So thank you so much. The channel continues to grow. I continue to try to put out daily content for everyone. And really, I'm just enjoying the growth of the community, the emails that I'm getting, the comments that I'm getting. It's just really fun. And I hope to be doing, well, not hope to be, because I will be doing, I'm planning to do more live videos. I've got more Forrest Fenn content, and hopefully as we move into April, then we'll be moving into to bringing on people to have more discussions in the political and economic realm, because that's a big part of where I want to get is not just my opinion, but having a discussion about politics and economics with other people. Because honestly, at the end of the day, as I get through this article and this video, it's time for the 40s and 50-year-olds to take over the management of our country. all of our president, Speaker of the House, Senate Majority Leader, they're all 70 plus. They're all going to make decisions. Half of the Supreme Court is 70 years or older. And I don't know that they're equipped to make the best decisions for America over the next 40 years. And I don't think that's a shocking comment. If you think that a 75 or 85-year-old is better equipped than a 50-year-old to, make decisions over the next 20 years, I would disagree with you, or a 40-year-old. And I think, Bill Clinton, George Bush, Barack Obama were all younger when they took office. And now we're looking at Trump in a second term or Joe Biden in a first term, being in the mid 70s to 80s. It just doesn't make any sense. Ruth Bader Ginsburg being 86, Stephen Breyer, I think is his name. He's 81 or 82. I mean, it just doesn't make any sense. McConnell's getting to be 75, 76, 77, something like that. You've got Pelosi's like 79. I mean, Dianne Feinstein, the senator out of California. I mean, why are all these old people making decisions, especially with the bailout and the $1 trillion or whatever? Anyway, I'm getting off on a tangent. Let me read what this professional author has to say. This, again, is an opinion piece in the New York Times from March 22nd. And I quote, "These are the days that test every leader, local, state, and national. They are each being asked to make huge life and death decisions while driving through a fog with imperfect information and everyone in the back seat shouting at them. My heart goes out to them all. I know they mean well, but as so many of our businesses shut down and millions begin to be laid off, some experts are beginning to ask, wait a minute, what the hell are we doing to ourselves, to our economy, to our next generation? Is this cure, even for a short while, worse than the disease?" I share these questions. Our leaders are not flying completely blind. They are working off the advice of serious epidemiologists and public health experts. Yet we still need to be careful about groupthink, which is a natural but dangerous reaction when responding to a national and global crisis. We're making decisions that affect the whole country and our entire economy. Therefore, small errors in navigation could have huge consequences. Of course, because this virus is potentially affecting so many Americans at once, we need to provide more hospital beds, treatment equipment for those who will need it, and protective gear like N95 masks for the doctors and nurses caring for virus-infected patients. That is urgent. And we need to immediately rectify the colossal failure to supply rapid, widespread testing. That is urgent. But we also need to be asking ourselves, just as urgently, can we more surgically minimize the threat of this virus to those most vulnerable while we maximize the chances for as many Americans as possible to safely go back to work as soon as possible? One expert I talked to below believes that could happen in as early as a few weeks if we pause for a moment and think afresh about the coronavirus challenge. Indeed, if my inbox is any indication, a thoughtful backlash is brewing to the strategy the country has stumbled into. And stumbling is what inevitably happens when you have a president who goes from treating the coronavirus as a hoax to a war in the space of 2 days. A lot of health experts want to find a better balance to the medical, economic, and moral issues now tugging at us all at once. Dr. John P.A. Ioannidis, not really sure how you say his last name, an epidemiologist and co-director of Stanford's Meta Research Innovation Center, pointed out in a March 17 essay on statnews.com that we still do not have a firm grasp of the population-wide fatality rate of coronavirus. A look at some of the best available evidence today, though, indicates it may be 1% and could even be lower. If that is the true rate, Ioannidis wrote, Locking down the world with potentially tremendous social and financial consequences may be totally irrational. It's like an elephant being attacked by a house cat. Frustrated and trying to avoid the cat, the elephant accidentally jumps off a cliff and dies. Dr. Stephen Wolfe, Director Emeritus of the Center on Society and Health at Virginia Commonwealth University, shared with me some thoughts he was hammering into an essay. Society's response to COVID-19, such as closing businesses and locking down communities, may be necessary to curb community spread, but could harm health in other ways, costing lives. Imagine a patient with chest pain or developing stroke, where speed is essential to save lives, hesitating to call 911 for fear of catching the coronavirus, or a cancer patient having to delay chemotherapy because the facility is closed, or a patient with advanced emphysema who dies for lack of a facility with a ventilator. And imagine the stress and mental illness that will come, already has come, from our shutting down our economy, triggering massive layoffs. Income is one of the stronger predictors of health outcomes and of how long we live, Wolfe said. Lost wages and job layoffs are leaving many workers without health insurance and forcing many families to forego health care and medications to pay for food, housing, and other basic needs. People of color and the poor, who have suffered for generations with higher death rates, will be hurt the most and probably helped the least. They are the housekeepers in the closed hotels and the families without options when public transit closes. Low-income workers who manage to save the money for groceries and reach the store may find empty shelves, left behind by panicked shoppers with the resources for hoarding. Is there another way? One of the best ideas I have come across was offered by Dr. David L. Katz, the founding director of Yale University's CDC-funded Yale Griffin Prevention Research Center and an expert in public health and preventive medicine. Katz wrote an op-ed in the Times on Friday that caught my eye. He argued that we have three goals right now: saving as many lives as we can, making sure that our medical system does not get overwhelmed, but also making sure that in the process of achieving the first two goals, we don't destroy our economy, and as a result of that, even more lives. For all these reasons, he argued, we need to pivot from the horizontal interdiction strategy we're now deploying, restricting the movement and commerce of the entire population without consideration of varying risks for severe infection, to a more surgical or vertical interdiction strategy. A surgical vertical approach would focus on protecting and sequestering those among us most likely to be killed or suffer long-term damage by exposure to coronavirus infection. That is the elderly, people with chronic disease, and the immunologically compromised. That's a word you don't see every day. While basically treating the rest of society the way we have always dealt with familiar threats like the flu. That means we would tell them to be respectful of others when coughing or sneezing, wash their hands regularly, and if they feel sick, to stay home and get over it, or to seek medical attention if they are not recuperating as expected. Because, as with the flu, the vast majority will get over it in days. A small number will require hospitalization, and a very small percentage of the most vulnerable will tragically die. That said, coronavirus is more dangerous than the typical flu we are familiar with. As Katz argued, governors and mayors, by choosing the horizontal approach of basically sending everyone home for an unspecified period, might have actually increased the dangers of infection for the most vulnerable. As we lay off workers and colleges close their dorms and send all their students home, Katz noted, young people of indeterminate infectious status are being sent home to huddle with their families nationwide, and because we lack widespread testing, they may be carrying the virus and transmitting it to their 50-something parents and 70 or 80-something grandparents. Okay, I said, calling Katz by phone at his home in Connecticut after reading his article, but we are where we are. Most states and cities have basically committed to some period of horizontal social distancing and sheltering in place. So can we make lemonade out of this lemon and not destroy our economy? I don't see why not, he answered. Now that we have shut down almost everything, we still have the option of pivoting to a more targeted approach. We may even be able to leverage the current effort at horizontal, population wide interdiction to our advantage as we pivot to vertical, risk based interdiction. How? Use a 2-week isolation strategy, Katz answered. Tell everyone to basically stay at home for 2 weeks rather than indefinitely. This includes all the reckless college students packing beaches of Florida. If you are infected with the coronavirus, it will usually present within a 2-week incubation period. Those who have symptomatic infection should then self-isolate, with or without testing, which is exactly what we do with the flu, Katz said. Those who don't, if in the low-risk population, should be allowed to return to work or school after the 2 weeks end. Effectively, we'd reboot our society in 2 or perhaps more weeks from now. The rejuvenating effects on spirits and the economy of knowing where there's light at the end of this tunnel would be hard to overstate. Risk will not be zero, but the risk of some bad outcome for any of us on any given day is never zero. Meanwhile, we should do our best to sequester from any contact with potential carriers, the elderly, people with chronic diseases, and the immunologically compromised for whom coronavirus is most dangerous. And we could potentially establish subgroups of health professionals tested to be negative for coronavirus to tend preferentially to those at highest risk, Katz added. This way, Katz said, the most vulnerable are carefully shielded until the infection has run its course through the rest of us, and the tiny fraction of those of us at low risk who do develop severe infection, nonetheless, get expert medical care from a system not overwhelmed. We are not counting on zero spread after the 2 weeks. We cannot achieve zero spread under any scenario. We are counting on minimization of severe cases by sheltering the most vulnerable from spread, whether by those with or those without symptoms. That is why we should also use this 2-week or longer, if that is what the CDC decides, transition period to establish through data analytics the best possible criteria for differentiating the especially vulnerable from everyone else. For instance, some younger people have been killed by coronavirus. We need to better understand why. There is some research, Katz says, that suggests many of them, too, had other serious chronic primary medical conditions, but this needs more data and analysis. Who exactly is at high risk must be based on the most current data and updated routinely by the relevant public health authorities. This is why pushing the federal government to expand testing as broadly and quickly as possible is so important. Katz has created a rough template for the 2-week plus sequestration of the most vulnerable strategy and how to think about coronavirus risk stratification and different responses on his website. Katz's approach is both sober and hopeful. He is basically arguing that at this stage there is no way of avoiding the fact that many Americans are going to get the coronavirus or already have it. That ship has sailed. We missed the opportunity for population-wide containment, he said. So now we need to be strategic opportunists. Let those who are inevitably going to get the virus and are highly likely to make an uneventful recovery get it and get over it and get back to work and relative normalcy. And meanwhile, protect the most vulnerable. During this time, we would want to set up mobile testing and temperature check stations or systems, as China and Korea have done, to identify those who may not comply with this 14-day isolation approach or for any other reason remain or become infected. We would also want carefully to confirm that once you recover from COVID-19, you are immune from getting it or spreading it again for a period of time. Most experts believe that to be true, said Katz, but there have been some reports of reinfection and the matter is not settled. Confirming that individuals are fully recovered, truly immune, and not capable of transmitting is a crucial element in protecting our loved ones most vulnerable to severe infection, Katz said. Once transmission rates are down to near zero and herd immunity has been established, concluded Katz, we can think about giving the all clear to the most vulnerable. This could take months, but Katz's plan offers the majority of the population the prospect of normalcy in some relatively small number of weeks rather than indefinite number of months. And all the while, of course, there should be brisk work on effective treatments and vaccine. These should be deployed globally as soon as reasonable. I am not a medical expert. I'm just a reporter, and I'm just a YouTuber who is afraid for his own loved ones, for his neighbors, and for people everywhere as much as anyone. I share these ideas not because I know they are the magic cure or have every variable thought through. And I welcome readers and YouTube watchers to express their doubts in the comment section. I share them because I am certain that we need to broaden the debate. I am certain that we need less herd mentality and more herd immunity as we come to terms with our hellish choice. Either we let many of us get the coronavirus, recover, and get back to work, while doing our utmost to protect those most vulnerable to being killed by it, or we shut down for months to try to save everyone everywhere from this virus, no matter their risk profile, and kill many people by other means, kill our economy, and maybe kill our future. Now, I read that article in its entirety without stopping, and I'm already at 20 minutes. I think he said what I was trying to say last week in a much more effective way, because he also, the author, interviewed other doctors. Now, I said that, I know a number of doctors and I've shared text messages. I never quoted them. They never wanted to be quoted, and that was never my point. I'm not a professional journalist, even though I have a journalism degree, but that's not what I'm doing here. This is more, the House Husband Diaries is more my opinion. But when I came across that article, thanks to my wife, it just made a lot of sense that there are really intelligent medical professionals out there who disagree with what the news is purporting. And what we're doing economically and financially to contain the coronavirus is just a detriment. And I think there's a better way to go about quarantining people, to go about fighting the virus while also supporting our economy. I don't think we have to shut down all of it to fight or to beat the coronavirus. And so that was the conversation that I was trying to have, or at least the points I was trying to make last week. So I thought that was a great article. If you have anything you want to say, comments, what have you, feel free. You can email me, carter@hhdiaries.com, or you can comment below. You can make your own video. Do whatever you want. Just let me know. It would be fun to have a conversation. If you want to come on the show and talk about different ways that we can try to combat the coronavirus, but also keep the economy going for future generations. Love to have any of these discussions. But I just thought that article was really good, was well written, and kind of shared some points that I was trying to make that maybe some people didn't necessarily agree with. And so I thought maybe that author made the points in a better way than maybe I was espousing them. So let me know what you think. Thanks again for watching this episode of the House Husband Diaries. As always, I hope you all are having a great day, and I will talk to you tomorrow.